COVID cases are rising in the Caribbean. Many persons in the United States aren't going to vacation or even visit their relatives there. The Centers for Disease Control and Prevention continues to add countries to level 4. What is level 4? That is their highest travel advisory, and they're advising Americans to avoid traveling to many Caribbean countries because of this very high level of COVID. What are these countries? Dr. Adrian Lorde, a doctor in Barbados, will be talking later about the many things that he has been doing on the COVID circuit across the Caribbean. He's a doctor in Barbados, and he's been assessing the COVID situation in many Caribbean countries. Dr. Lorde, welcome to Brooklyn 45.
Thank you, and good evening to all. It's my pleasure to be here.
COVID. There's been headlines across the world, and the COVID in the Caribbean has been headlines not only in the Caribbean, but also here in the United States. What should people be doing at this point, especially those countries where the level has risen to a 4?
Well, good evening again. Level 4 is a designation by the Center for Disease Control and Prevention in Atlanta, where they assess the number of cases and the rising in cases in various countries of the world. And their job and duty is to advise US citizens where they should go and shouldn't go. Level 4 is actually the highest level of warning for countries in the rating. Initially, when countries got to level 4, they said that, the US was being unfair, but no, our cases are rising in a lot of countries. Some of them are dipping a little bit, but say Barbados, we have reached the peak. And in level 4, they tell you, avoid travel to that place. If you must travel, say to Barbados, make sure you're fully vaccinated before traveling. Because of the current situation in the country, and they make recommendations for vaccinated travelers. So if you're traveling, make sure that you're vaccinated. So it is a serious situation that we are finding. And as you said, Barbadians and West Indians are now hesitant to come back home for Christmas, which means that not only Barbadians and West Indians, but our visitors, especially in the Caribbean, where tourism is very important, will continue to suffer.
I want to talk about the suffering a bit, but I also want to revisit what you said earlier. It's not just Barbados, it's Guyana, it's Jamaica, and you've traveled to many countries where this is a problem. What are some of these countries you've traveled to?
Yeah, it is Aruba. We have Antigua, St. Lucia, Guyana, as you mentioned, Grenada, Belize, St. Kitts, Nevis, Jamaica, the Bahamas, the US Virgin Islands, Dominica, Cuba. All of these countries are in the level 4, are at level 4. And if we look at these countries, we have seen what has happened to their countries, to COVID-19, as a result of COVID-19 in recent times.
You mentioned earlier that it is affecting the tourism industry. Expand a bit on that.
Yeah, a lot of our countries are tourism dependent. And without tourism, a lot of our countries suffer. For instance, in Barbados, they say we put all our eggs in one basket, but we don't have many baskets to go. Sugarcane, which was king, is no longer king in Barbados. And we depend on the sun, sea, and sand. People like to flock to Barbados, especially in the winter months. And we depend a lot on tourism to bring some money into the economy. As a result of COVID-19 and the tremendous expenditure that the governments of the region would have invested in hospitalization, PPEs, medication, personnel. They had to employ more persons to do the various drugs. In Barbados, we built a separate hospital just for COVID-19 patients in record time too. But and it's going on and on. And the other health services, and we can talk about that later, are suffering as well because a lot of focus has to be placed on COVID-19, and not to mention the cost of the vaccines, the cost of testing, the PCR testing. In Barbados, we've done a whole lot of testing, PCR testing. And as far as the number of cases, doses of vaccines, we're now over 250,000 doses of vaccines. Some of them first dose, some of them second dose. And because of the economic problems, disparity, vaccine disparity, I call it, it's very difficult to obtain the vaccines. So we have to be spending lots of money to educate as well as test and also rehabilitate and treat persons who have COVID-19.
What are you hearing from other doctors in the Caribbean? I know you've been visiting these Caribbean islands. What have you been hearing from these doctors? And what have you been hearing from governments about the problems in getting hold of the vaccines and the problems in determining which vaccines they should be using?
Well, from my colleagues in the countries, they are stretched out and stressed out. They are fatigued. They can go almost no more. They are working longer hours under difficult and frightening circumstances to deal with this pandemic, especially in recent months with the surge that we have seen due to the Delta variant. Similarly, the governments and CARICOM and the head of CARICOM have been speaking to the various governments, like, USA. We got some gifts of some of the Pfizer vaccine. We've had to speak to India. We've gotten some stuff from China. So it's been a difficult thing to get vaccines because they don't look at our little quantities that we want. We tried to see if we could get through the COVID network, Covishield, to try to get more drugs. And through PAHO and the World Health Organization, they're trying their best to help us. But we have to try to help ourselves. We are lending vaccines from country to country when the need arises. So that has been a good thing that's been happening. A lot of cooperation, but also just getting the vaccines and getting them then into people's arms is the other thing. It's getting them, then get them into people's arms has been a problem that my colleagues in the various countries have stated, and the governments. I mean, I heard only recently that in some of our countries, our vaccination rate is down at 20%, and that's far from ideal.
So what are the governments doing to make sure that the vaccine rate increases? I know here, the governor, the mayor, even the heads of various institutions, educational institutions and others are saying, if you don't get vaccinated, and they've been given deadlines, you don't have a job. Now, is any of that happening in the Caribbean?
Yes and no. Yes, some of the countries have instituted mandatory vaccination for frontline workers. Antigua has made it such, and I think Grenada now has been doing it. Trinidad has gone the route of safe zones, and Barbados also gone to safe zones. Safe zones are category of places where you need to be vaccinated to work and also vaccinated to go. So that is a start. In Barbados, we have not gone as far as Trinidad has, because going into shops and barber shops and supermarkets and so on, they're going that way. we just recently implemented it, and it's mainly for certain frontline workers. And if you don't vaccinate, you have to be tested on a weekly basis at this time at the cost of government in order to show that you are not infected. Because it is a serious thing, and there's a lot of vaccine hesitancy throughout the region. And education is where we need to go, and where we failed early in the pandemic. We saw what was happening in the US, we saw what was happening in the UK, we saw what was happening even in China. But we did not anticipate this vaccine hesitancy, which is in our nation. And therefore, we assumed vaccines come, people will take them. As far as which vaccines to take, that also needs to be emphasized and taught to people, because sometimes there could be too much choice dilemma, or people just not knowing what the benefits of which vaccine is. And that's what I have been doing. I myself took it upon myself to do a number of blogs, a number of WhatsApp videos. I've done 153 so far. Just educate my friends about the pandemic and what they should and should not do, to give them advice from time to time.
Where can we see these videos that you have been producing?
Well, I'm a little selfish. I've sent them mainly to my friends and family, and they tend to my church of Christ the King in Barbados, St. Michael. I haven't really pushed it on the social media on a broad scale. That's because of time. On mornings I take a little jog, Sam. And when I'm out there jogging or walking, I get these vibes. I come back, take my camera and start talking. And at breakfast, I just send it to my WhatsApp group and some other people, and they just send it out. And it's been very popular, really. Some have gone viral. Depends on what I say and what I say, because it is no nonsense. I don't. If the government does something and I don't like what I do, I say it. If they do something and I like it, I say it. So it's nothing, no holds barred, and people like that, straightforward, but giving them the information that they need about the virus, the variants, and the vaccinations. That's what virus, variants, and vaccination. People call it COVID update.
Yes, people must like that. I mean, you are a respected doctor. You're not, as a Bajan may say, a poo-poo doctor. You've been a doctor for a very long time. You're an associate lecturer as well at the University of the West Indies. And you have I'm going to explain this to many people who wouldn't understand this. You are an officer in the Order of the British Empire, the OBE. You were given this by Queen Elizabeth for your work in sports medicine. I want to come back to sports in a second. But let's talk about your work in sports medicine, not only in Barbados, but across the region and internationally.
Yes, Sam. After graduated in 1982, it was, and even during my studies, I remembered back in 1979 when I was in Jamaica, the Barbados team came up there for the Carifta Games. I didn't have a doctor. Prior to that, I had been assisting in fundraising for the Athletics Association in Barbados. So they invited me to be part of the team. And I recognized then there's a need for this specialty. So after I graduated, I then did a lot of studies in sports medicine. I did also family medicine. And I've been working with sports teams in Barbados and throughout the world, even in the Americas, since then. I formed the Barbados Sports Medicine Association, the Caribbean Sports Medicine Association. I was president of those organizations for a long time. And I even became president of the Pan American Sports Medicine Federation, which is the hemispheric body, for a long time, for 8 years, where I spread my talents throughout the North America, Central America, South America, and the Caribbean. Through it, I've gone to 6 Olympic Games and several Pan American Games and Central American and Caribbean Games. And the recognition of the Officer of the Order of British Empire which is a British designation.
Mm-hmm.
They have the OBE, the MBE, and the what's the other one? OBE, MBE, and then there are other, and of course, knighthood is something that you can be, that the Queen recognizes what you do, and you're offered this special order, which I was very happy to receive. I didn't go to Buckingham Palace. I got it from our own Governor General here in Barbados.
Yes.
I'm not so fussy. I had the offer, but I didn't bother to go down to just to spend 5 minutes of my
of your valuable time.
Yes. Yeah.
Even though that time would have been spent with the Queen.
The Queen, yeah. But
let's get back to sports. You said you've been to several Olympics. You obviously have been around athletes from across the Caribbean. Now, how has COVID affected athletes and athletic games and other types of games? I know here one of the big news is that a lot of team members in various sports are not going to be allowed to play because they refuse to take the vaccine. Is this happening in Barbados? And is this happening throughout the Caribbean? And in what countries is this happening?
Well, I'm not aware that this is happening in the Caribbean. We just had the Tokyo Olympics, where athletes were encouraged to have their vaccines before going there. I know that in Trinidad, they had 2 or 3 members of their team tested positive, while in Japan and never were able to participate in the games because of that. But the mandatory vaccination is not happening. However, in November in Cali, Colombia, is the Junior Pan American Games. And all athletes over the age of 18 must be vaccinated before they go there. That's the rules of Colombia. They want to make a safe game. So along that level, that is what is happening. As far as sports in the Caribbean, it has been affected. We have had cricket, Caribbean Premier League held the last 2 years, but in one location. The year before, last year it was in Trinidad, and this year it was in St. Kitts and Nevis, where all the teams played all the games on one ground for the 3 weeks competition. But a lot of other sports were canceled or postponed, and due to various protocols in the various islands, there was limited participation because you couldn't gather. You had to scatter. In the situation of the CPL and so on, that's the cricket, they had created a bubble. Everybody came into the bubble, tested before, tested during the competition and so on. But you don't get that type of thing going on in the regular domestic competition. Regional competition, we were supposed to have the first ever Caribbean Games in Guadeloupe last year that had to be canceled. A lot of other regional competitions had to be canceled because of COVID-19. So our athletes are suffering because of lack of activity from a physical side, mentally, and financially as well. Those who may have been involved in various sporting activities, they have not been able to play, they have not been able to train, and therefore the effects on that, on them and on sporting activity, has really been tremendous.
You talked about protocols. Do these protocols differ from country to country, or is there an agreement amongst governments as what a single protocol should be adopted?
Yeah, each country has their own protocols, and their own protocols is driven by their local situation, what their numbers are, whether there was community spread or not, where you were seeing the largest number of people coming. If they were coming from overseas, like Trinidad locked down for a long time and would not even allow their residents to return home. Cayman Islands did it differently, and being a British dependency, they were able to contain their numbers. And now we see with the variants, they're going up. So each country had their own protocols. Whether or not they had a curfew, and what hours the curfew were for, from when till when. Jamaica had no movement days or no movement weekends where people weren't allowed to go. We had lockdown weekends where we were not even able to go to church. So each country had their own protocols.
You talked earlier about travel. What are the restrictions, I assume that there are restrictions governing travel between the various Caribbean countries. What are those restrictions like? I know lots of people here in the United States are somewhat hesitant about going to the Caribbean, but what about inter-island travel?
Yeah, that is still a challenge. I know in Barbados, the Barbados Tourism Authority, we put things in place so that there were certain countries in almost a bubble situation. If you were coming from Antigua or St. Vincent, where there were lower numbers of these cases, you will not have to do a PCR test on arrival, or you could do a rapid test. However, with the upsurge in numbers that we have now, that has been relaxed, or rather instituted some more curfews. So right now, most countries, you go into the country, you have to have a PCR test 3 days before, and then on arrival, you must be tested again. That is even within the Caribbean countries because of what's really going on. We tried to do it differently, where CARICOM countries would agree that we wouldn't institute these things, but now that things have gotten worse, we have had to strengthen and tighten a little bit more. And it's make it difficult because airfares are expensive, Sam. You have a hotel accommodation, you have to quarantine for 24 hours, and then minimum until you get back the test. Because of the large number of tests which were done, a lot of our local laboratories have been stretched and challenged to get back results in certain periods of time. And people who would have come home around December, January, recognize that whereas they expected a test at that time, I think it was 2 days or 3 days, they had to go on to 5 days, and hotel accommodation is not cheap. So there have been challenges, but there's not any one rule across CARICOM that would allow persons to freely travel at this time.
Level 4 is the highest. Now, as a doctor, where do you think the spike is taking us?
Very good question.
What are your concerns about so many Caribbean countries being at a level 4?
It is blacklisting us. Whereas in the US, things are relaxed, and in the UK, things are relaxed, we are now being looked at as one of the high COVID-19 countries or regions of the world. South America and Central America also has that designation at this time. So where can it carry us? It's carrying us down deep in the hands of the International Monetary Fund and all the other lending agencies. We can't pay back our loans. We don't have enough money to pay our civil servants. Our natural abilities to do superior things is being affected in the Caribbean at this time because of the level 4 and the need for us to get back down. So we need to put measures in place to try to stem this increase in numbers. And one of the things that we need to do is educate, vaccinate. And if we can get more persons out there vaccinated, because some tourists are saying, we're not coming unless we are sure that your organization, your hotel, your staff are fully vaccinated. And you'll be surprised how many frontline workers are not vaccinated. So we need to vaccinate. And we hope that if our numbers are up And some countries, I said, are as low as 20%. Some are high as 80% in Cayman Islands. They're as high as that. And Barbados is in between there. So if we can get that levels up and reduce the spread of the virus and the variants, because the virus loves a host. And if the variants, and they mutate into the variants, so if we can do that, we could then put pressure on CDC, say, listen, let's put us down a bit, because that is not a good thing when we are at level 4. And so many countries are at level 4.
Yes. My producers are telling me that we've got 30 seconds left. We're going to have you back, Dr. Lorde. I want to thank you very much for being our guest here on Brooklyn 45. And I know you are very concerned. Sometimes I can see it on your face. And I know people in the Caribbean are concerned. I understand lots of them are not doing anything about it. They're not taking this very seriously. So in 10 seconds, just reinforce that people must take this COVID seriously. 10 seconds.
COVID is cruel, and you must take it seriously. Let's contain the virus. Let's do what we have to do. Wear your mask properly, wash your hands, keep your distance, and take that jab.
Thank you, Dr. Adrian Lorde. And he is not only a Barbados doctor, of course he is, but he travels a lot in the Caribbean, and he is well respected. Thank you very much for being our guest on Brooklyn 45. And to our viewers, we thank you for watching this program. We invite you to partner with Brooklyn 45. You can do this in several ways. You can tell us about topics you'd like us to discuss, and you can go to our website and become a supporter, a monthly supporter, or give an annual amount of money for us. We want to continue our programs. We are a 501c3 not-for-profit organization. So when you support us, our communities benefit as well. So tell your friends, everyone you know, about Brooklyn 45. On behalf of our team, I'm Sam Taitt.
Brooklyn 45 is a 501c3 not-for-profit, and we welcome your support. Check out our website, brooklyn45.com, and feel free to donate or share it with your friends and family. Have any comments or questions? Send them to our Facebook, facebook.com/brooklyn45tv. If you have any questions or topics you think we should cover next, shoot me an email over at brooklyn45tv@gmail.com. Thank you again for watching.